Let's have a serious conversation on the Elias Macko Show on a very serious subject, medical assistance in dying. I don't think there's anyone now that doesn't know someone who has opted for medical assistance in dying at the end of their life. It was just last week, in fact. I have an extended family member, 98 years old, and chose to leave this earth with medical assistance in dying. And I remember, since this debate in this country had started many, many years ago, I'd always been a proponent of medical assistance in dying. But in recent times, I've just noticed a few stories that have made me pause. Recently in the Montreal Gazette, there was a piece by Matthew Hayes. Title of it said, "Should MAID be paused in Canada?" Many of the points that Matthew brought up, things that I'd been thinking about in recent months. And let's welcome Matthew Hayes. He's a professor in media studies at Marianopolis College and at Concordia University. He's on the line. Matthew, welcome to the program.
Good morning.
So why'd you write this piece in the Gazette?
Well, for a lot of the reasons that you just talked about in your introduction. I know people who've opted for MAID, and I supported it and voted for politicians who were going to bring it in. I was glad that Justin Trudeau brought it in. But, you know, there's been certain cases, in particular, the case I wrote about in my op-ed piece, the Normand Mounier fellow who was not really given proper care at an emergency ward in Montreal, and eventually, because he sustained some injuries as a disabled person, he opted for MAID because his quality of life had just gone so far downhill. It's been about 10 years since MAID came in Canada, but in that decade, we've really seen a lot of our healthcare social safety net get frayed in a way that I'm finding kind of alarming. I don't know about you. I don't know if you've been to a hospital or emergency ward lately, but I feel like I supported this as a choice. It's got to be a choice. It can't be the only option.
And that's the thing that's getting me, is that it seems in some cases medical assistance in dying is being used as a treatment option, where, you know, instead of actually dealing with people's issues. And that's where I go, wait a minute, that was never, what I thought was the deal here on medical assistance in dying. What are the numbers? Like, just how prevalent is it right now, medical assistance in dying?
It's. I think the numbers have stabilized this year, but it's like 36% of the 36% of Canada's MAID deaths were in Quebec. That's from 2024, and apparently they've sort of stabilized at that rate. There's thousands of people are opting for it, and of course we've gained a lot of international attention for this, including what I thought was a very well written cover story in the New York Times Magazine about it last year. So we're gaining a lot of attention for it. What gets me about it is it must exist if we're going to have MAID, and as I said in my article, and you agreed in your intro, we support it, right, in principle, and I'm glad that your relative had the choice to make. But it must exist alongside a properly functioning healthcare system where people have properly funded palliative care, where people have elder care, where the disabled are treated properly. We can't have this lurking around if people are thinking, well, I'm just not going to bother trying to make ends meet as a senior citizen or as a disabled person, so I'm just going to opt out, right? Like that shouldn't be where we go with MAID, is my strong feeling.
Let me, I don't know if you've heard of this story. There's this came out last week, and it's a family of a 26-year-old who lived in Ontario. He had diabetes that led to vision loss. He had depression. He applied for medical assistance in dying in Ontario, was rejected. He eventually goes to British Columbia and finds doctors there that accepted his request. And it was at the end of December at a Vancouver funeral home. He accessed medical assistance in dying, and his mother, not very happy about it, saying, there's a bit of there was almost doctor shopping involved to get medical assistance in dying. That's another thing I'm thinking of too. It's like, younger people that with proper care should be able to have decent lives that are opting for medical assistance in dying. Like, to me, it makes no sense.
What a terribly sad story, isn't it? I mean, we need to make sure that we're supporting people. And unfortunately, what we're seeing everywhere right now is we're in this terrible post-pandemic hangover where all governments are strapped. Everyone's gone into debt everywhere. And so there's just all this talk of, quasi-austerity, if not full-on austerity. And that's going to mean cuts to social services. And I know affordability will be the big issue for the next Quebec government, whoever forms it, whether it's probably the PQ or the Liberals. We don't know yet, unless the CAQ manages some incredible magic act and has a comeback. And I know the priority will be affordability. That's what people are talking about because everyone's strapped. But I think the other thing that people really is on people's minds is our healthcare system. It seems so strained right now. It seems like when you enter a hospital, people are just overwhelmed, the people who are working there, and we need to support them, and we need to figure out how we can provide these services much, much better.
We're with
Matthew. And then I'll feel more comfortable about MAID.
Yeah, absolutely. And that's it. I want to feel comfortable with the system that we have. We're with Matthew Hayes. He's a professor in media studies at Concordia University. Penned a piece in the Montreal Gazette. The question asked as the headline in the piece is, should MAID, medical assistance in dying, be paused in Canada? So Matthew, let me get to that question that's asked in the headline. Let's say we pause medical assistance in dying. And then what? What do we do after? If we were to pause it, what should we do afterwards?
I think that perhaps I wouldn't suggest pausing it necessarily. I'm asking that question rhetorically. I would say we need to make sure that we're asking the right questions when people come. I'm sure, the people who are deciding on MAID, and you talked about physician shopping, I'm sure that people are asking ethical, good questions, but we need to make sure that they are given all the alternatives, all the possible things that they could do that could be done for them to help them. I have a friend in Alberta, for example, who has a disability, and right now the government is shuffling things around with how disability payments are made, benefits are made to disabled, in a really crass effort to try to kick some people off the government assistance payrolls. And I think it's really immoral of that government to do it. Because it's causing a lot of stress and anxiety among disabled people in Alberta, and some people there are talking about MAID. So it's something people are turning to when they have no options. They have to be given the full range of options.
Now, as you point out in your piece, if you look at medical assistance in dying in this country, Quebec has, from the most recent data, 36% of MAID deaths in the country. We're not 36% of the population, right? I think we're about 22% right now.
Yeah.
So we have an outsized share of that. Why do you think that is?
Well, that's an interesting question. I mean, Quebec is, the province of lapsed Catholics. People, some of the people I know who struggled with the option of MAID were people who were perhaps Christian, maybe Catholics or Muslims, and so for them, suicide is not an option, at least within their faith. And so some people in Quebec, where people aren't as connected to organized religion, they may feel like, so what? Suicide is not immoral, or it's not something that's going to send me to hell. So for agnostics, for example, I don't think or atheists are not as concerned about that. So it may have to do with that. It may have to do with the fact that people in Quebec are pretty open-minded about things, as I wrote in the opinion piece. But I worry about my second point on following that was, I'm not sure, because we see that 77% of Quebecers in one poll a couple of years ago or last year said they feel Quebec healthcare is poor. And we also have, it's a problem across Canada, but 2 million Quebecers don't have a family doctor. I mean, that's actually quite outrageous, because we know that your health outcomes are not good if you don't have someone, checking under the hood of the car every year.
Matthew, I'll leave you with this, okay? Here's a text message. As we're discussing, here's a text message I've gotten from a listener. They write this: I totally agree. I'm a home care palliative nurse. It should be an option, but too often it's chosen due to the lack of proper care. Doing my very best to provide optimal care to my dying patients at home, but lack of resources is an ongoing and growing concern. I fear for my patients. I do my best, which leads to me doing 12 hours of unpaid overtime a week. So, to the thought there that it's a lack of proper care that's leading many to the MAID route.
Wow.
Matthew, listen, thanks for coming on the show. I'm going to direct our listeners to your op-ed in the Montreal Gazette. It's titled, Should MAID Be Paused in Canada? Thanks for coming on.
Thank you very much.
That's Matthew Hayes. He's a professor in media studies at Concordia and Marianopolis.
I'm Dylan Playfair.
And I'm Tyler Smith.
We're putting loneliness in the penalty box by talking to some of our favorite athletes about the importance of friendship.
This is Bromance.
Bromance is brought to you by Charm Diamond Centers, proudly Canadian owned and operated. Charm has been part of your love stories and bromances for over 50 years. And you can find Bromance on the iHeartRadio network or wherever you get your podcasts.